Welcome to CFRI Cystic Fibrosis Community Voices, a video podcast series created by and for the cystic fibrosis community.
Hi everybody, thanks to those of you who are joining us via Zoom, and thanks to those of you who are watching via Facebook Live. I'm Siri Vaeth. I'm Executive Director of CFRI, Cystic Fibrosis Research Incorporated, and I'm really happy to be here tonight with Meg Dvorak, who is a licensed clinical social worker and the CF social worker at the Adult CF Center at Stanford. So tonight we are going to be having a discussion about CF and mental health. It's going to be a mix, little information, question and answer, discussion. But before we launch, I wanted to first thank our sponsors who are making this possible. And we are really grateful to Vertex Pharmaceuticals, to Chiesi USA, and to Gilead Sciences for their support. So before we jump in, I just wanted to give an overview of how this will work. We're going to start off with just some overview, mental health issues, programs that CFRI offers to support people, all our psychosocial support programs. Then people can have a question and answer, and those of you who are participating via Zoom will be able to ask your questions directly. And then at a certain point, we're going to stop streaming live. We're going to stop recording the meeting. And those of you who want to stay on with us and have a more possibly relaxed conversation, or those of you who didn't want to ask a question because it felt a little nerve-wracking when it was live or recorded, will be able to do so. So that's what we are going to do. And I'm wondering, Meg, do you want to introduce yourself, and then we can launch into
Sure. Thank you so much for that introduction. And just to elaborate more on me, I'm Meg Dvorak, licensed clinical social worker, as Siri mentioned. I have been with the Stanford Adult Cystic Fibrosis team since 2010. And prior to that, I worked in a pediatric setting for 9 years. And so I'm really familiar with both pediatric and adult issues, as well as all of the complexities of the transition that can happen for an emerging adult with a chronic illness. And I'm happy to be here. I'm honored to be asked to do this tonight, and I just want to welcome everybody that's joining on Facebook and on Zoom.
Great.
So it's a pleasure to be here.
Thank you for sharing your time. And those of you who participate in either our caregiver support groups or our adult support groups will know Meg, because she is the facilitator, one of the facilitators for these groups. So let's just jump in. I have a few slides that I wanted to show. So part of the inspiration for having this town hall meeting was about a year ago, we hosted an externally led patient-focused drug development meeting with the FDA back east, and the whole point was to bring the experience of individuals with CF to representatives of the FDA as they're making decisions about different medications that might be before them for approval. And what was interesting is, of course, everybody always thinks of CF and as a progressive lung disease, and the expectation would be that most of the conversation and people's experiences were going to be about exacerbations and lung infections and pneumothorax and hemoptysis. And indeed, those were issues. But also GI issues were a huge issue for impacting quality of life, and mental health issues. And so it's really important for us to, again, just appreciate the complexity of the disease and really recognize the impact of the disease. So the slide here, I just really liked this quote. Isolation, like cancer, starts in one area and silently spreads to so many others. It robs you of all that you do not want to lose. And I think that is a key thing for our community, is the issue of isolation because of cross-infection issues. And so CFRI, in recognizing that, has a variety of programs to help support our community. And I'll just give you a quick overview. I'm sure Meg can talk about this backwards and forwards, but years ago there was a huge international study, 10,000 participants across the globe, And there were many things learned from that, but a key thing was that our community has rates of depression and anxiety that are 2 to 3 times higher than those of the general population. And I think, I don't know if people who are watching know this, but I have a 24-year-old daughter with cystic fibrosis, and I have to say when the results first came out, we all went, wait, we needed a study for that? Of course we know that. And from that study, what was interesting is that mothers of children with CF had the highest rates of anxiety. So again, it's of course we knew that, but sometimes it's so important to have a study to document it so that strategies can be put in place. And we know mental health services, it doesn't matter. It is still extraordinarily hard to access mental health services. And that, even if you have insurance that's going to cover your mental health services, just finding the right provider, if it's a limited list of providers, whether there's a waiting list, it's extraordinarily challenging. So, and what we do know is that if people are depressed, or parents of children with CF are depressed, that it is going to impact adherence to one's medical regimen. So we have many different programs to help support our community. One of them, I think this is going to be our 6th year in 2020, an online Living Mindfully with CF class that really incorporates principles of mindfulness-based stress reduction, helps people deal with depression and anxiety and chronic pain, and it combines yoga and breathing and meditation. And it's wonderful. It's taught by the fabulous Dr. Julie Desch, who herself has CF, so it's just such a supportive, caring environment. And we've done all sorts of studies with participants, and indeed it really does help people cope with depression and anxiety. We also offer 3 monthly support groups currently. 2 of them are for caregivers, and one of those groups is for parents of children with CF. The other one is a group for parents or partners of adults with CF. And Meg and her colleague, Kate Yablonsky, facilitate these groups every month. And those of you who haven't joined, who are caregivers, you really should consider participating. The other group that we just launched recently is a support group for adults with CF. And again, Kate and Meg are the fabulous facilitators. So you have anything you want to add about this?
Yeah, the groups are very accessible because they start California time at 5 p.m. The adult CF patient group starts at 6 p.m. So anybody from any time zone, maybe minus Europe, it's a good time to call in the evening, and you can carve it out. It only happens once a month, and we pick a topic associated with living with CF, and the topic is pretty broad and it's relevant to a lot of people. And so I would just encourage people to try out the groups. We've had a lot of people that are regular attendees, and they've gotten to know each other through the groups, and from that, beautiful things have happened. So I just want to encourage people, if you have not tried it out, to give it a shot. The next group is happening, it's the 3rd Monday and Tuesday of December.
And for a long time, people called in, right?
Right.
But now it's on Zoom. So those people who want to connect and see each other.
That's right.
I think it's a personal thing. Some people don't like the camera on. For me, when I'm
But
in a
it's
meeting,
nice that there's at least a choice. So if you're a private person or you don't have access to a webcam or what have you, you have the option to call in. Or if you want to see people and have that different kind of dimension to the group, which I think does add a lot, you can call in and activate your camera and be live in the group on Zoom. So it's just a great way to cut through geographical barriers as well as the whole isolation piece that Siri was just describing.
So another program we offer, and quite sadly, it is the end of 2019 and we have expended all the funds, but I'm in the midst of trying to seek funding for 2020, is our support for individual counseling. And as I said before, we all know that's so hard to access mental health services, and quite often we receive calls from people who may have coverage, but they really don't like the providers in their list or don't connect with them. And quite frankly, if you don't connect with your provider, it's almost as if it's more stressful than helpful. So What we do is cover up to $120 per session for 6 sessions of counseling, and we let people choose their own provider. The key is they have to be licensed, so like Meg and LCSW, an LMFT, or a licensed clinical psychologist. That's the one thing. So those of you who have already taken advantage of this program, I'm really glad it's there for you. And those of you who are interested in it, please stay tuned, because as soon as we have funding for 2020, we're going to let everyone know. For mothers of children with CF, we have an annual retreat called Embrace Retreat. And every year, about 30 to 35 women get together for a weekend in Menlo Park. And I will say, for those of you who are tuning in from other parts of the country, women came from 10 states last year. We have people come from Georgia, Maine, Texas. It is a really wonderful weekend that combines everything from presentations to yoga to support groups. And the key thing is really just finding your tribe and connecting with these other people who really understand your journey. And then our CF Summer Retreat, which is such a special program and really a rarity in this day of cross-infection issues. And if you can see the screen, there's a great quote from one of my favorite adults with CF, who really stresses that, family and friends can be there and support you and do what they can, but that really, at the deepest level, the most helpful thing is to be with other people who understand your journey, who are on the same path. And so this offers that opportunity to people to come together. And we do have, anybody who's interested in this, contact me later, because we do have very extensive cross-infection control policies and procedures, and people come back every year. Okay. So, and then I think the final thing, now I've lost my track. They were all my cues.
Retreat, the mother's
retreat, but
Pound CF, any of that?
The wellness. We're hoping we can bring back some of our wellness programs. Again, it's all funding contingent. And then the other group that, again, trying to seek funding, which would be new, is a bereavement group for people who have lost loved ones to CF. And this has really come about, I think, from like the support groups that you facilitate.
Exactly.
The Mother's Retreat that we hold, that it's a really unique and small community. And to lose a loved one to CF quite often, that means they're younger. And so I think a lot of people go to possibly hospice to seek support and feel disconnected because it's a very unique experience to lose a loved one to CF versus quite often when you go and they're older people who have passed away, and it's a disconnect for people.
It's also just more complex because there are some families that have multiple family members with CF, or sibling sets of 2 or 3 where one of the siblings may have passed. And it's just a more complicated type of grief because the survivors are living with the same disease and doing the best they can. And it's a heavy burden to carry.
Absolutely.
So to have this kind of resource would be a treasure.
So please stay tuned. I really want to make this happen in 2020. And so, and I bring that up as one, we're just constantly trying to have our ears open to what our community is needing and to then find a way to fill that need. So with that, I'm going to turn it over to Meg.
Okay, thank you. So as I mentioned before, I've been doing CF social work for almost 10 years now. So I've seen a lot in our program. We have one of the biggest adult CF centers in California. And just to put out a disclaimer, I am the adult CF social worker, so I'm speaking a little bit from an adult lens. So just be mindful of that. If there's a lot of people with young kids, babies with CF, I'm not as familiar with those things, but somewhat familiar. But I just thought I would sort of outline the mental health concerns and then talk about the CF landscape in terms of mental health and then treatment. So I'll start with just risk factors for mental health concerns in CF. As we all know, this is a devastating lifelong disease. It has an incredible treatment burden, and that burden tends to increase with age. So you can imagine the drain that can be on new parents that have an infant or a child with CF, and then to try to hand over the care of all of those years to your young adult who's emerging and possibly going off on their own or going to college. That's a big transition. And obviously the multiple losses that a person can experience throughout their life living with CF, just the loss of certain freedoms that people that don't have CF have, and the dreaded progression of disease, and that always sort of hanging over people. And every new infection that they get, or every time they get admitted to the hospital, there's always that question: is this disease progression, or is this an isolated exacerbation? So you can just imagine the elevated level of anxiety and stress in just day-to-day life of managing this very complex disease that only gets more complex as a person ages. So then just moving into more of the actual mental health concerns that we see cropping up in our clinics, depression in the patient, and that's on a big spectrum. We see just dips in mood from time to time related to dips in health, or we see pervasive complex depression that's just present every day. And then also there's anxiety. These are the two sort of common colds of the mental health world. Anxiety having lots of different forms: generalized anxiety, procedural anxiety, existential anxiety and hypervigilance, just about managing such a stressful disease, trying not to forget things, and then just the trauma of living with a disease like this, especially in the advanced stages, end stage, and then undergoing lung transplant. We've seen a prevalence of PTSD in people who have undergone transplant, and I believe a study was done at Stanford showing prevalence of 12 to 15%. And so just to recognize that that's there and to intervene much earlier from a mental health perspective before it's after the fact can help to mitigate that. What else do we see? Just the, as I mentioned earlier, the pervasive stress and the transient nature of mental health problems that can come and go as different transitions come and go in the disease. A person that's developed diabetes, or a person that's transitioned from pediatric to adult care, these are all big milestones and can create a lot of stress. Mm-hmm. And so it's really important that we have regular conversations with our patients and families about mental health and its importance, as it is definitely correlated with a person's ability to follow this complex disease regimen. I mean, I was just at the North American CF conference a month ago. Siri was there as well, and I attended a session that talked about adherence. And they're still showing that adherence is approximately only 50%.
I was amazed.
And I was really amazed by that, because as a provider, we aren't hearing this in self-report. I think patients and families like to present that they're able to follow it and they're doing everything, but in actuality, the rates are much lower. And so that just presents the fact that mental health is so important to address, because if a person doesn't have the right mindset, or they're not even going to their clinic appointments, how do we expect them to follow the treatment regimen? Right. And also with the advent of all these wonderful new modulators, mm-hmm. if they're not taking a modulator, how are they going to get any benefit from it? Right. So that's just another thing I wanted to touch on. I know there's a lot of buzz and excitement about Trikafta, and this is a miracle, and it's presumed that the Trikafta, as well as Kalydeco and all the other modulators out there, we would be seeing improved quality of life and improved mental health. And yes, that's true, but the jury's still out. This drug is so new, and I think there's a lot of hesitancy in the community of like what's really going to happen.
Right.
And feeling a little bit of mixture of hope with also a little bit of fear and trying not to be disappointed.
Right.
And also defining what does better mean for me, because that's also going to be on a continuum. Better for one person that's starting Trikafta could be that I'm not going to get on the transplant list this month, or better for someone else could mean that they're going to work full time for many, many years and live well into their 50s, 60s, maybe 70s. So I just think there's a lot of mental health issues and focus that we need to look at with these new modulators.
I feel like once we start doing the
yes, I'm sure it's going to come up. So
I've just heard so much. I mean, from the absolutely guarded optimism because life has been fraught with disappointments and therapies that were supposed to help and didn't, and then obviously people that 10%, know many people who are not able to
exactly
use Trikafta, and they feel like they're staring through a window, watching the party inside, and how hard that is for people who can't take it. And then we know there are some people who are going to thrive, and that's going to create a whole new issue of self-identity and
exactly.
And such. Conversely, some people will have high hopes and it may not work out as well. And so it's I really feel like this is going to be a great topic of discussion. But I do want to circle back too to the whole PTSD, because I've always thought it really should be studied more, because it's post-transplant, obviously. But the people I've spoken with who have had massive hemoptysis, and I mean I can say, as somebody who does not have CF, but with a daughter with CF, like that scares me terribly. That I cannot imagine that sense from what people described it, feeling the rush and then just feeling like you're drowning. And I've spoken to many people who said really they feel like it's post-traumatic stress from the incident and then the dread, because it isn't like there's a warning sign.
Right.
And so you live in dread with that. And I think not speaking, out of turn for my daughter, but I would say she definitely feels like it's a sense of always waiting for a shoe to drop, because you go in for a culture, you've done nothing differently than you did prior to the last clinic visit, but then you get your results back and something horrible is growing, and it's not because of anything she's done. It's just there. So there's this constant sense every appointment is fraught with some dread.
Exactly. And that's what I was speaking to when I talked about anxiety and the different forms of anxiety, PTSD being one, and procedural anxiety, or the existential and the hypervigilance, which does relate to that shoe dropping that you were talking about, or the dread of like developing a resistant bug or having a sudden hemoptysis out of the blue, especially if you're out in public or you're at work or you're at an airport, or God forbid on an airplane. It can happen at any time. And I think the definition of a trauma is a threat to a person's safety or community. And so really you can think of any medical crisis can fall into that.
Absolutely. So I'm familiar with Stanford. And I don't expect that you know every other clinic, though I do know you are very networked with your other CF social workers. So I'm just curious. I mean, with a few years ago became, the implementation, doing the GAD-7 and the PHQ-9 and doing these annual assessments. Do you have the sense out in the broader CF landscape that, there's detecting higher levels of depression and anxiety because of this measurement, but then if that is so, where are people going? What are the other resources besides, the ones I talked about that we offer, but in other clinics, are people able to receive mental health support as patients, or are they having to leave and then find support outside of the clinic setting?
Yeah, that's a multi-part question. So I'll start with the first part, which is the screening that we've been doing, and that's been in place since around 2015-16 as a result of the TIDE study. Yay, research. And the prevalence of anxiety and depression, I think we're consistently across the board seeing something similar to what was in the TIDES, which is about 20% for depression, which is elevated from community samples, as you mentioned, and then anxiety being a bit higher, more closer to 30, with a lot of variability between centers. And I don't know, everybody does their screening slightly differently, but, and then what we're doing with that. And that varies from center to center too. There's a lot of centers that are smaller, that are more rural, and so the resources for mental health will be not as good in those areas. But if you're closer to a big city, there's going to be more mental health providers. But I think the great news is that the CF Foundation is really getting behind the importance of including mental health as part of the CF care model. And so there's extra funding for mental health coordinators, and these folks have become more established as CF care team members. So, for example, at Stanford, we have a psychiatrist, Dr. Scher, who's actually on our CF team. We've demonstrated the importance of having her on our team, and she is now a member of our team. And so she can provide therapy services, inpatient and outpatient, as well as mental health evaluations and medication support. And I know other CF care centers across the country, both pediatric and adult, have mental health coordinators. And they're not necessarily psychiatrists, but they could be a psychologist or an LCSW or sometimes even a nurse, depending on the center. And the role of this person is to address mental health concerns in the clinic, as well as carry out the screening. And some of these folks are lucky enough to be able to carve out a therapy practice. And so the patients at those particular centers are able to go to them for individual therapy appointments. So as this awareness continues to increase and its connection to medical outcomes, I think we're going to be seeing more and more resources for mental health treatment.
Great.
Does that answer your question?
That does answer my question. And I think now, if we can handle this, we can open it up if people have questions for Meg. I know someone emailed questions who was not able to be here tonight. So if Meg, you want to jump off with those, and then people can.
I can start with these. There's 3 questions. Am I supposed to say her name or no? Okay. So question number 1, how can you ascertain whether the apathy, isolation, indifference, and failure to socialize has gone past the point of just being a teenager thing to being actual depression, especially when he has his therapist thinking he's fine, but at home he is just not fine? So I don't know. That's really tough. As a person who has a teenager at home, I do recognize that there's a lot of isolation that goes on and some apathy and laziness, and that can really mimic some symptoms of depression. But a real diagnosable depression is the presence of a depressed mood for 2 weeks or more that's almost present every day, as well as what's called anhedonia, which is a loss of interest and pleasure in your usual activities. So if you're seeing those 2 things present every day for 2 weeks or longer, and another thing that really makes the diagnosis is that it's clinically significant and distressing to the person, that would be the differentiation.
Got it.
So hopefully, did you have anything you want to add to that?
That was perfect.
Yeah. So obviously, if he's already seeing a therapist and the family is thinking one thing and the therapist is saying another, there's always the option to get a second opinion or start with a different therapist, or have somebody at the CF Center, maybe the mental health coordinator or social worker, who knows this patient, hopefully across many visits and possibly years, to do a more formal assessment. of depression.
And it is so challenging because you want the teen to have his autonomy and individual relationship with the provider.
Exactly.
And yet, I also know it's like the adherence issue. It's you're wanting to sometimes project a level of coping,
right,
even with the provider.
And just mental health is somewhat of a soft science in that so much of our data is based on self-report. And just a person looking at questions and circling a 1, 2, or 3. So it's really hard to know exactly what's going on in a person's mind and whether it's real depression or just teenage apathy. Question number 2, what is the best way to pull a CFer out of the mindset that treatments are a burden that they hate and take a more careful and active role in doing them well? Ooh. This is a really good question. And I mean, there's no putting sugar coating on the fact that like spending an hour in a vest with a nebulizer in your mouth there's some unpleasantness that goes with that. But to pair the treatment with something that's pleasurable. So that could be putting headphones on and streaming something that you love from Netflix or Hulu, or catching up on your recorded shows, or maybe spending time with a family member during that time. Another thing is just like, I mean, the question has the word mindset in it, so that implies that a person just needs to think more deeply about their daily care and what it means to them and what story they're telling themselves about that treatment. And usually because the brain has a negative bias, it's like an evolutionary thing that we tend to really gravitate towards more negative mindsets and remember more of the salient negative things in our lives rather than the positive things. So to have a daily practice of gratitude, to try to start a practice of meditation, and to develop more self-compassion. There's also another type of therapy that I think is very helpful called ACT, Acceptance and Commitment Therapy. And seeing a therapist that practices this approach can really help a person work creatively around being more accepting of themselves, given everything, and not to wait for something to happen to feel better, but to actually try to feel better today by leaning into their experience, their lived experience, and to develop more self-compassion, if that makes sense.
I hear, it's interesting. They're always like the buzz things, and that modality seems like it's gaining.
It is gaining a lot of popularity.
And I think the Boomer Esiason Foundation is funding some research.
They are. There's a center in Drexel. Yes. And they have a psychologist who I admire very much. Every year she speaks at NACFC about ACT, and they're starting enrollment. It's now multi-center, actually. There's a couple other centers, and they're enrolling subjects in an ACT study to see to look at pre and post mental health to see if ACT helps people with CF.
Actually, I was thinking of seeing if she could come to the conference this year.
That would be great. Dr. Virginia O'Hare.
Yes, she's great.
Yep.
And it is hard, with the mindset, because I think about, coming back to that adherence issue, it amazes me. I think what is so hard, it's just the grind. It isn't just like it's today. And there is that thing about mindfulness and being just here in this day. But when you really know every day, tomorrow and the next day and in a month and in a year, and you're every day going to be putting that vest on and sterilizing the nebulizers and getting all the meds ready. I mean, it is exhausting. And I think that is really the key, how to obviously people, especially adults, but as with kids, at a young age, having kids understand why they're doing it, so they own it, sort of the motivational interviewing strategy, so it isn't the nagging. But then, as people get older and it is that day in, day out, and they're responsible for it, I understand it is, I would think that's like the great puzzle to unlock. Yes, there's the complete intellectual understanding of the necessity of doing it.
And then there's the actual doing it,
And the actual
putting it into practice, and then maintaining that. And it is, as you mentioned, it's draining. And CF does not have a remission like some other diseases have. And so to just continue to show up every day for yourself, for your family, and to try to work with your language, stories, thoughts, mindset around that. Just like meditation is a practice, this is a practice too, and try to put those together.
Absolutely. Okay, well, I can't see the screen, so if anybody is with us still and has a question, I apologize, and we'll go to this question, and then maybe if we can hear people.
I think I
does
can
somebody
hear
have
somebody.
a question?
I have a topic to bring up.
Oh, yay.
Okay.
Are we keeping our names? Well, you can see our names on the screen, I guess. But now that these new medications are coming into play and people slowly are starting to feel a little bit better, Meg, do you talk with patients about not only talk therapy, but I know doctors share that would be the supplement of some medication, but also the incredible influence exercise has on mental health?
Yes, absolutely. And I didn't even mention this in my introduction, and I wish I had, but mental health, unlike standardized CF care where there's guidelines like you need this, you need to do this for respiratory, you need to do this for diabetes, mental health is sort of, there's no guidelines. Yes, we have guidelines for screening, but the treatment of mental health is on a huge spectrum, from anywhere from do nothing and just see if it gets better to like, I'm going to take medications, I'm going to see a therapist, and I'm going to go to church every Sunday and whatever else. So exercise definitely fits into that. And I'm always telling people that exercise is a good idea at any stage of disease. Even when a person's on oxygen, it's absolutely essential for just building confidence in yourself and just getting that blood flowing through your body into those critical areas, and including your brain, for just that lasting feeling of positiveness that can happen when you've exercised for the rest of the day. And I know CFRI has this Pound CF class that does that, and I don't know if they have it anymore, but there's actual programs.
Yeah, and we hope to have some of them continue. I mean, I know just for myself, if I don't exercise regularly, but once you get into, everything is a routine, right? So once you get out of that routine, it can be hard. But I really feel like, for me personally, exercise has almost more to do with my mental health than my physical health.
Yeah, I would agree with that.
So I'm wondering if other people, what we could do at this point, unless somebody has a burning question they want to share online, meaning with anybody watching on Facebook, but we can stop recording the meeting now.
There's one more of these. I don't know if you want me to.
One more question.
Yeah.
Oh, we'll answer the one question, and then what we'll do is we're going to bid farewell to our people watching on Facebook, and then we'll stop recording the Zoom meeting, and then anybody who has any other questions or comments or things they want to share, it might be easier to do so. I just wish I could see people. It's a little disorienting.
Yeah.
So.
Okay. So question 3 is, my child is almost ready to head off to college, but is still forgetting certain meds for treatment on a daily and weekly basis. Is it a better idea to keep him home for another year while he proves he's responsible enough to head out to college than to allow him to go and let the chips fall where they may? That is a tough one. And we get this all of the time. And when a person is at the age of going to college, it's usually around 18, and that's also the age when a lot of patients graduate from pediatric programs and transition to adult programs. And it's also an age when there's a lot of risk-taking and people trying on independence and having different consequences. So it is a very high-risk time. And my answer would be, it depends. I mean, how much he's doing for himself right now before he goes, and how badly he wants to go, and maybe incentivizing him with taking on more and seeing if he can manage it. There's some really good videos and teaching things about going off to college on the CF Foundation website, if people want to watch that. And I don't know if you guys have anything.
Well, we do have some printed documents. And, I mean, I would say just my gut reaction is
Wait.
Actually, no.
No.
Actually, the opposite.
Let the
And of
chips
course,
fall where they may.
This is knowing,
Okay.
just this little teeny, drop in the ocean of that parental-child experience. So, but just as somebody whose daughter went off to college, I mean, I think part of it is all the build-in now. It's like, don't wait till they're out the door. Act as if they're at college now. In other words, set up the schedule.
Yeah.
Be doing that now, because I do think it is a parental fear, I think, of letting go, and this fear because we dread the consequences, and yet it's going to happen at some point. That young person is going to go, and I don't know that waiting a year and proving himself is the answer. I mean, part of it is the front loading before they go, and then maybe it's what you're doing is in agreement into that first year to help support that child's adherence.
Yeah, it's so individual too. There's so many circumstances that play into that. I've seen many instances where a person was doing poorly in the pediatric setting, was not following their daily care, and all kinds of struggles with the parents, and then the person transitioned to the adult program and then just suddenly got their act together. And just there was something about the freshness of the providers and the setting and the new independence that they had that really motivated them. And then other times it can go the other way. So
it's just, it's been hard. I mean, it is so individual. I do know, having a lot of friends whose kids have transitioned through the years since, now Tessa's 24, so I've seen a lot of people go through this, and it is sort of that self-assessment as a parent. What's my fear speaking that might hinder my child's growth and development? And that may not be what's going on, but it is, as a parent, we always have to pay attention, because, we live with anxiety and stress because we want to protect our kids. So, and at a certain point,
it is a big letting go and rite of passage for a parent who's coddled this child since they're an infant in many cases, and then to just sort of let that go, I think can be incredibly distressing. Yeah. So not an easy decision. But at some point, they have to fly the nest. Yeah. So good luck with that.
I had a question, and Devin seconded. How do you find a good counselor? I've had a horrible time. I have government insurance, which is complicated. And then I've had 2 counselors that have gone on to other jobs within the past year. And so I've found, finding a counselor, one that understands chronic illness is almost impossible, but 2 that takes your insurance and that you don't have to keep telling your life story. I mean, let's face it, we've got a lot of baggage. Yeah. And unpacking that frequently can be discouraging.
Yeah.
Absolutely.
I totally agree with you. And I've heard some kind of research stat that the chemistry with the provider is almost 50% of sort of the therapeutic work, that it's that important. So you do need to get a person that you trust, that you connect with, and that you want to move forward with. And so if you've had some failures in that in the past, have you turned to your CF social worker or mental health coordinator on your team for an actual recommendation?
Well, my team is in a different city. So they're about an hour away. And, when I asked before, they, didn't have a referral network.
And so, I'm kind of, in a different city, so it'd be really hard to drive there for a counselor. But when I asked previously, they didn't have a referral,
And how do you feel about telehealth? I do know people who actually are in therapy with providers, and it all takes place via Skype or Zoom, because that would be an interesting thing to find a network of people who offer services that way, because then people would have access regardless of where they lived.
Let me tell you, Siri, I think that would be fabulous, and I'll tell you why. I end up having a lot of appointments a month, and so when I get stressed out by appointments, the first one I cut is my counselor, because it's not like cutting my nephrologist or my cardiologist.
Right.
Cutting things seems to be the first one that's easiest to go. And there's days when I'm tired and I don't feel well. That doesn't necessarily mean I don't need to talk to someone.
Right.
Yeah.
But it just that I may not be able to get to their office. And the third reason is, germs. It would be so nice if I could do this at home and I didn't have to worry, especially in the wintertime, about everything I touch and, who's been coughing and whatever. So I wish we could have something like that. I think it would make a huge difference.
Well, I think you're going to set me on a mission now to do outreach to the providers that we've worked with here and see which of them would offer their services online, because that would be, you are not the only one. And truth be told, there's a CF Center, and there are certain centers that are very keyed in with us. Like they're on top of when we have funding, we get tons of referrals. And then from that, you have certain providers, and they're great. And it's really great because they know CF, and you're not using this very precious time explaining about all the things related to CF.
Right.
Conversely, if you're concerned about cross-infection, that's a whole other teaching component for that provider if they have more than one person with CF that they're seeing. And so it would be great to have people who have this built-in expertise already about not just chronic disease, but specifically CF, where you wouldn't have to hassle with traffic and stress and cross-infection issues and could participate. So I think you just lit a fire under me.
Can I say one more thing too?
Yes.
So a couple of years ago, there's a mental health advisory committee with the foundation, and they take on mental health as a topic, and they develop all kinds of programs for the CF centers that they want rolled out. And one thing they created was a mental health sort of Dropbox account for all CF social workers and psychologists who work in the centers. And whenever a patient comes and they're starting with a new therapist who is totally naive to CF, there's an already developed PowerPoint that they can give the patient to give to the therapist. And the therapist can just educate themselves with this PowerPoint that's already designed by people with CF.
Right.
So that's available. So whoever you see at the CF Center should have access to this Dropbox.
Great. Any other questions, comments, anything?
I have a related question. Someone I know has expressed interest in wanting to find a counselor, but also feels like really discouraged. So I guess I'm answering my own question here. I think I should send all these resources to my friend as well. But I guess, is there a good way to encourage my friend? I can't obviously find the counselor for them, but I want them to keep seeking help if they feel they need it.
Right.
Yeah.
Well,
but if they're so overwhelmed with finding a counselor, I don't have as much experience.
Yeah. Well, and it's so great when you have a referral to someone that, either somebody who's seen that person and really like them, though obviously it's such a personal issue of who you connect with. But I would say, I mean, I'll say this personally, it is hard work finding a therapist because you're calling somebody you don't know. This is the person you want to go share like your most deep personal things with. And, you know, now I'm thinking it would be really useful to have almost like a toolkit for people who are seeking a therapist. Because I think that people, if you haven't been in therapy and you're just starting out and you're trying to find somebody, you're like, how do I even know? What do I ask them? So like that first phone call, just to, you know, have concrete questions to ask maybe to see, you know, what their strategy is, what their, you know, you don't want not to be too like theoretical, but literally how they work with people. Listening, is it giving pointers? Is it what? So now I'm thinking, Devin, that's a whole other area, because I do believe, and just seeing from our program here, that people will call us and they're in pain, they have anxiety, they really want to have therapy. They go through everything to, you know, get the thing launched, and then don't start therapy. And we follow up with people, and sometimes I think what it is really is just that fatigue and the nerve-wracking point of finding that provider. And so if we could help people just bridge that gap, that would be helpful.
Setting up therapy and then going is such an arduous, multi-step process with lots of barriers along the way. There's access, there's cost, there's availability of the therapist, there's experience and expertise of the therapist, as well as the mental health itself is so transient. And just one day to the next, a person might feel motivated, and then the next day they feel better and they don't go. Right. So I've seen this so many times. A person is very well-meaning and they want to go, and the referral is made, and then they don't make it there for lots of reasons. Right. This is common.
Well, with that, I think we will bring this to a close. I really want to thank you, Meg, for sharing your time.
Thank you for having me.
You're such an amazing resource for our CF community. So generous with your time. And I thank everybody who participated, and I look forward to seeing you all. Hopefully next time I'll see your faces.
Bye, everybody. Have a good
Goodbye,
night.
and thank you.